Okay, I don't know why I'm doing this live. It's just really meant supposed to be a video, but sometimes I don't know what exactly I'm doing. So this is about the spinal cord stimulator. There is an Abbott control that I actually have, and I had this put in almost 3 years ago. So for patients who are considering this, it's actually been a really good thing. The spinal cord stimulator is something that's placed in T8 and T9. That's the thoracic region of the spine. You, in essence, have a little stimulator that's honestly probably to half the size of this. That's actually embedded just underneath the skin. So there's actually two processes with this. The first is the trial, and the trial is designed to go for 7 days. I remember I got mine on a Friday, and it was supposed to be removed the next Friday. The problem with the trial when I had it is the tape that they use to adhere it to your skin because it's not fully implanted. It's basically a battery pack and the stimulator itself that's outside of your body. But that tape actually ate through part of my skin and had to take Benadryl. And, the side effects of Benadryl are that is the key ingredient in most over the counter sleeping pills, which is diphenhydramine. So, if you have a sensitivity, it's certainly something you want to let your surgeon know. Now, coincidentally, I'm getting a peripheral nerve stimulator placed on Monday. So I think that joyful event is 5 days away. But getting back to the Abbott and the stimulator, these things are actually great. It has tonic, which is a consistent waveform that's created. My issue tends to be in the lumbar region, L4, L5. I've actually had 12 different surgeries on my spine. So finding something that's separate from medication to do that has actually been amazing. So the peripheral nerve stimulator, some of the other issues I personally have are entrapped nerves. So some of those nerves in that same area, coincidentally, right next to where the stimulator is, makes it harder for ablations and nerve blocks to take place. But I've had probably a dozen ablations within that lower region of the spine. So I'm pretty excited to see how the peripheral nerve stimulator works, minus the tape, of course. But if you have been a candidate for a spinal cord stimulator, this one is the Abbott model. I know they have a new Abbott, which actually allows you to charge that while it's still in your body. Mine, and they have somewhere between a 5 and 7 year life, is something that's going to have to be replaced. It's a pretty easy surgery considering all the surgeries I've had. I mean, anterior posterior lumbar fusions with instruments that get cages in the lower part of the spine. But I would really encourage anyone that's considering this or been recommended by your neurosurgeon or physician to look into these things. It's actually been amazing. And now we're only hoping that the peripheral nerve stimulator is half as good as the spinal cord stimulator is. There are a couple of things that you have to do before that, in addition to the trial, that there's actually a psych eval. I was afraid I wasn't going to pass the psych eval for various reasons. The why, number one, I'm sitting here, I got dogs staring me, and I'm talking to a computer screen. But honestly, I wish there was something like this when I was considering that. They can refer you to some patients who currently have it, but remember, no two outcomes are going to be the same. So it really depends on your own situation. But it's been great. The After the psych eval takes place and you kind of move forward, and the unfortunate thing with these types of devices is medicine's a practice of trial and error. So it probably took a year and a half after I initially started complaining of pain within that region. So before the device was implanted. But if this is something you're considering, I encourage you put a comment on. I will give you my experience. I'm looking at all of my different MRIs and things that I have up here. But the best contact, obviously, your physician. But if you want to talk to someone who has one, has some pretty tremendous results, I would love to be a springboard or a sounding board for you if you have any questions about this. So that's it. I'm going to go cook some steak for dinner with some basmati rice and peas. And hope you all, if you are considering this, have a great experience, as good as my experience has been. Thanks again.